Okay, hello and good evening. This is the January 4th, 2021 regularly scheduled school committee meeting. It is 6 p.m. I'd like to wish everyone a happy new year. Call the meeting to order. This meeting is being held remotely in accordance with the Governor of Massachusetts March 12th, 2020 order suspending certain provisions of the open meeting law. Also, as folks can see, many of us are collectively in the same room, but also per the governor's order, the public will not be allowed to physically access the school committee meeting. Members of the public can access the meeting via Zoom or the Facebook feed. Okay, all the school committee members are in attendance this evening, and we will start with our first order of business, which is approval of minutes. If I can have a motion, please.
Move to approve the regular session, the executive session meeting minutes of December 15th, 2020.
Motion's been made by Bill.
Second.
Seconded by Beth. Discussion. Hearing none, all those in favor, please say aye.
Aye.
Those opposed, nay. That motion carries 5-0. Next up,
Move to approve the December 15th, 2020 regular session meeting minutes.
motion made by Bill.
Second.
Second by Antonella. Discussion. Hearing none, all those in favor, please say aye.
Aye.
Those opposed, nay. That carries 5-0 as well. One more, please.
Move to approve the December 21st, 2020 regular session meeting minutes.
Motion has been made by Bill.
I'll second it.
Second by Beth. Discussion. Hearing none, all those in favor, please say aye.
Aye.
Those opposed, nay. That carries 5-0 as well. Mrs. Saletti, thank you very much for those minutes. Okay, and this is the point within our meeting where we have an opportunity for visitors to speak. If you'd like an opportunity to do so from the community, now would be your chance. And if anyone attending the meeting would like to do that, you can raise your hand now, and we will bring you in. I'm not seeing any. Mr. Mackey, you see the same?
Nor am I.
Okay.
Maybe repeat your offer, or are you good?
Yeah, going once. Yep. Okay. We have committee and subcommittee communications. Would any of the committee members like to say something at this point? No.
No.
All right, we're good. Excellent. Moving right along. We are going to bring in our health experts to give us an update. We have with us Kelly Lombard, our nurse leader, Dr. Clark, and Amy Petrosky, our health director.
There
If
she
all
is.
can come off of, or turn your video on, that would be appreciated.
Sorry, I was running late. I apologize.
Yeah, no, right on schedule. You wouldn't even notice if you didn't say anything. And Dr. Clark, if you could just turn your video on if you're there. All right, while we're waiting for Dr. Clark, Amy, would you like to start off with some of the information locally?
Sure. Yeah. So I sent this over a little bit earlier. So we'll give you just a little historical view of it. So in October, we had 122 cases total. In November, we had 172 cases total. 31 of those were pediatric cases. December, we saw a market increase. We had 351 cases total, with 44 of those being pediatric cases.
Okay.
The last 3 weeks, we have been a red community. And I think that has a lot to do with the holidays. I don't think that was unexpected.
Right. In terms
My
of,
video was disabled by the host, so it has to be brought up by the host as well.
okay. Don, can you address that for Dr. Clark, please?
Yeah, I'm working on it.
Thanks, sir. So as you all know, we have a scheduled increase of in-person learning scheduled for the 19th of the month. And Amy, as you said, we did expect there would be somewhat of a spike from the holidays. What do we know about transmission within the schools? Are we hearing about transmission in our schools, other schools? If you could address that topic.
Yeah, there's only been one known transmission within our school systems. And with prompt contact tracing, we were able to really keep that at a minimum. And I don't know if Dr. Kark has more knowledge about that kind of as a bigger picture.
My knowledge is that just that in the surrounding school districts and in our school district, there hasn't been a significant amount of transmission within the schools. Even those kids who are in a hybrid model, or in the case of the parochial schools who are 100% in school, they're not having any transmissions.
Yeah, I would say that's consistent with the messaging that's going across the state as well, is that schools are not a major source of infection.
Right. And so you're all aware of our plan. Our goal is to maintain social distancing within the school at least 6 feet. And actually, we'll go into this a little bit further in our presentation later. Certainly, masks will be mandatory throughout the day. There will be opportunity for mask breaks and for lunch breaks, but other than that, masks will be mandated. Hand washing, highly encouraged. We will have squirt stuff for your hands.
Hand sanitizer.
Hand sanitizer, thank you, readily available. So knowing all that, and I know you're all completely aware of our plan, are we on track in terms of bringing the staff and the students back in, understanding that we're in a pandemic, but relatively as safely as possible with our plan currently?
Yeah, I think you guys, we kind of touched on this earlier. I think the school committee made a really tough decision in August because we didn't know about transmission in schools. We didn't know what this virus was going to do to children. And I think the safest decision for our community was made to get some more data and to see what's working and what's not working around, Western Mass, Massachusetts, and across the country. And I think with the data that we have now, we're able to see that school-based transmission is not something that is a major source of infection. And so with the mitigation strategies that you guys have discussed, which is the masks, the distance, and the frequent hand washing, I think we're bringing our students and staff back to a situation that is much safer than we would have thought in August.
Amy, I don't know if you can answer this from the contact tracing that you've been involved in. Is it something that can be extrapolated from data that you're seeing, that often the transmission is in a situation where, sort of the three strategies we're using, distancing, masking, and hand hygiene, are not being practiced? Is that something that we could say, or is that just more theoretical?
I think logically we can say that, but I don't think I have data to support that that's the way that the virus is transmitting. We do know the number one clusters that we're having are household clusters because we're not wearing masks in our home. So, we can look at those types of facts and extrapolate out that when we are doing things like wearing masks, washing our hands, and keeping a safe distance, our likelihood of contracting the virus is much lower. And I think the reality is, and we touched on this again earlier today, but we know the virus is in our community. I just read you numbers that show the virus is in our community. And so I think our job, all of us together, is to make sure that the people don't start getting the virus within the school systems. We can do that with proper contact tracing, with good testing, and with parents following the same protocols that you guys are following in school, out of school. Right? So those processes have to also be done within our community. And when someone is sick, is to really be honest with the contact tracing, because we're finding that parents are having a hard time with that. They don't want to share the names of their kids' friends who they may have been around. And the only way that you guys are going to be successful is that if we're able to notify those students that you should not go to school for 10 days, say, or whatever the situation with that may be. And so that's an important message for parents. You guys can't be successful if they're not part of that process.
And actually, that's some of in my update, I'm going to be saying some of those same things. So thank you for that.
Sorry, I didn't mean to steal your thunder.
No, that was great. But actually, would you go over, because the quarantining part has changed. And, we initially were saying, okay, we're quarantining for 14 days. but that's no longer necessarily the case. Can you just outline that for us?
Yeah. So at the beginning, like Gordon just said, it was a 14-day quarantine after you were considered a close contact. Now that we have more data and more information, that has been reduced. It was first reduced to 10 days, and now it's been reduced to 7, assuming certain criteria are met. So after 5 days post-exposure, if parents or teachers or staff have a negative test and still remain asymptomatic, they're allowed to return after day 7. So that's a half of what it used to be. That means our students and teachers are coming back to what most likely is going to be a significantly less disruptive situation, even if there are exposures. Now, if the parents choose not to test their children, there are different time frames from there. Those get a lot more convoluted, and I think explaining them here might get a little tricky.
Okay. The 10-day quarantine, though, when would you bump to that?
10 days. Individual has, so no testing.
No
The
testing.
individual hasn't had any symptoms through 10 days. They can come out on day 11 and stay out as long as they remain asymptomatic.
Got it. Thank you. That's going to be important. One of the things that we've talked about is all the way through is how we do the close contact tracing and what quarantining might be necessary. And so certainly to cut it in half, with the possibility anyway to cut it in half, is something that's entirely new and is actually good for our planning.
Yeah, I
Dr.
think.
Clark, I wonder if you could help us as we talk to our families as they tend to come back and our staff. We're going to talk again later about self-certification for families if their kids are sick, what they should do, what they should look for. Can you just go over some of the symptoms that families and staff should look for, that they should consider that's not the time to come in and maybe it's time to get tested?
So any evidence of fever, cough, sore throat, and headache, those are the top 4 symptoms that should indicate that you should be tested. Runny nose associated with any of those, they should be tested. Fatigue associated with any of those, they should be tested. Those people who have chronic cough, asthma, allergies, those types of things, they should be in contact with their primary care physician about what symptoms they would use, because they might be different, or they might be getting tested a little more frequently with those symptoms.
And once someone decides that they should be tested, whether it's through consultation with their physician or they have one or several of these symptoms, are they to self-isolate, quarantine until they get the result? Is that what
They should. They definitely should isolate until they have the test results.
Okay. And then once they receive a negative test and they have these, is it fair to say they can come back to school at that point?
They can, unless their situation is that they're really high risk transmission. If it's somebody in their family, it might be warranted that they get a second test if they're in the same household. That's all.
Yeah, and Greg, I think it matters if they're getting tested just based on symptoms or exposure, right? So if they were exposure, they would still follow that quarantine. But if it was symptom-based only, then yes.
And Amy, if there is an exposure, you would know about it, is that correct? Potentially?
So when someone tests positive, the CTC calls them and asks them to let us know all of their close contacts. And they review that a close contact is 10 to 15 minutes, less than 6 feet, mask or no mask. It's not, that is not relative. So a lot of people say, oh, well, I was there, but I had a mask on, but that doesn't preclude you from being a close contact. So then the parents ideally would list all of the people that their children have been around. And I think somehow there's become a negative stigma around having COVID. And that's really unfortunate, because the best way to protect everybody is to alert them. And so people are reluctant to share those contacts because, oh, my kid had a sleepover and I don't want people to think that I'm not taking this seriously, or whatever the case may be. But all we do with that information is to ensure that they understand what the criteria is that they need to follow in order to not infect anyone else in their home or anyone else in our schools or in our sports or, wherever we may be.
Kelly, I wonder if you could talk about the PPE that we have available, but also the expectations that we have for both students and staff to bring in their own PPE, what's acceptable, face masks versus gaiters, and if they don't have it, what we have to provide for them in
Okay.
some.
Sure. So I have a lot of adult reusable masks that, if any staff want them or any bigger children. I also have reusable masks for students. They're all adjustable, reusable. Students should be bringing in their own, but if they're ever soiled or it's not fitting properly, we can always, get them one. We don't approve of the gaiter mask because it doesn't fit snugly over the nose and around the mouth. And we don't want the vented masks either because some droplets can escape. So the blue, sometimes they're yellow, 3-ply. Let me see if any of you have one. Antonella has one on right now. Gordon has a fabric one on, that's fine. And for the younger kids, they do sell kids face masks, and some of them you can adjust the ear lobe so you get a nice, tight seal. But we do have them available. We have plenty of PPE. We have our medical waiting rooms ready. Nurses are available to any staff with any questions. Gordon and I went around to all the schools and we did a presentation and, staff were able to ask questions. I think it went very well. Questions were very appropriate.
So to that point, Kelly, what if families have questions for their students in terms of issues they may have with masks, or say they want to wear a shield or something? Can they contact the school nurse, or what would you recommend?
Contact the school nurse or myself. We also have the contact tracing number. If they, want to talk to somebody in the contact tracing, we give them the number for the health department. But I would start with your school nurse, just so we know, what's going on and what we need to educate about.
Sure. Dr. Clark, how are we looking on timing in terms of testing and results and turnaround?
It's taken a little bit longer. Probably we're going 3 to 5 days now for test results. So let's hope that after this surge for the holidays, the Thanksgiving holiday and the Christmas, New Year holiday, that it will go back down. Again, it's not for availability of tests. It's just the availability of the staff to run the testing or perform the tests. We have enough tests in the area.
And how would someone go about getting a test? Are you still recommending the Stop the Spread sites? Do they need appointments or doctor referrals? Just so families know.
So all of those are options. The Stop the Spread sites are still available. They have them at Holyoke Community College, at the Eastfield Mall. And they have been other ones popping up at UMass, in Amherst, and in the Berkshires. So, but there is a Stop the Spread site. You can go on there and figure out what's available when. The doctor referral is also fairly easy. We do not require that we have to see the patient to give a referral, and we will make the appointment. It's usually within 24 hours that we can get the appointment for somebody who is symptomatic, and somebody who's asymptomatic and just been exposed. We can usually get it within the time frame of the 5 to 7 days after exposure. And then there are self-referral sites as well, that the same doctor referral sites. Bay State has a phone number, and I think it's I can't remember the number. Sorry, I'd have to get back to you. I gave it to you the last time though, but you can call in and schedule your own appointment to be tested without a doctor referral, as long as you have actually with or without symptoms, and they will give you the right time frame and within which you can get tested.
Amy, did you have something to add to that?
I was going to say, so the reports that I'm getting, the Stop the Spread sites have a long wait, but you are getting results in 24 to 48 hours. I mean, most people are getting results very fast through the Stop the Spread site. So if you are looking to get the results fast, the line might be 6 hours, but you're going to get your results the next day, as opposed to going another route where you can make an appointment and then you're waiting 3 to 4 days for the results. So it's really balancing. Parents will need to balance which way they want to go.
Can you just show up to the Stop the Spread sites? You just get in line? Is that how that works?
They
Yes.
all are different, I think. The mall, you can just show up, but I think some of them out at East, you require an appointment. I'm not sure what UMass is at this point.
I think UMass and Holyoke Community College require an appointment.
Okay, and folks can find that. They can Google Stop the Spread Massachusetts and they'll get the website to do that.
Yes.
Okay. Other questions from the committee?
And one question that might be a good one to outline is, so we have staff coming back right now for January 11th. And I know that people are worried about sort of the holiday surge. But we had, in coordinating with you, kind of looked at those dates as possibly being past that. Would you still agree that that's something that makes sense in terms of the 11th and then students in on the 19th?
So yeah, the CDC, part of the quarantine directives that we talked about having been adjusted is the reduction of that 14 days. And now without testing, it's 10 days. So even if someone were asymptomatic, you're coming back after that 10-day window. And the likelihood of becoming positive after that 10-day window is very, very nominal. So I think the 11th is a pretty safe bet to be bringing staff back in. And the 19th is certainly well without of that window for bringing students back.
Thank you.
And I think it's worth noting, just a plug for families and staff out there, this is going to be a community effort to get in. And I know you've all alluded to this a little bit already, but you know, if we want to make this successful, we need the community, the staff, the families, to make an effort to maintain social distancing, to wear masks when they're outside their family, outside their pod, and certainly for contact tracing, to be aware who you know, you've been with over the past week or so. But just a plug for an effort. You know, our numbers are high right now, and the way we lower those, and we know, Amy, as you said, they're happening mostly in houses and gatherings, is to just try and follow the things that we know work. So just worth making that plug, I think.
If I could just add, I know I've said it before, I work in a local district, and when September rolled around, I felt optimistic but fearful of a lot of things going into it. And from that point, I've done everything from being a classroom teacher for a couple weeks to being my regular para, to being a remote para, to pivoting and becoming this a specials teacher on and off for a couple weeks while I'm doing the remote para, and I'm going to be moving into another teaching position in the morning and a para in the afternoon. This whole time I've done it. I've gotten the tests, I've been a close contact that wasn't, I've done it all. But when I walk into school now, I'm not afraid. I'm cautiously optimistic every day. I don't feel, and I want our staff and our students and our parents to understand that, you know, nothing is 100%, but that I don't feel fear. I am optimistic every day. I think that my school district has done the very best job, and I think that we absolutely are following suit, if not, you know, also maybe we're doing it better. I don't know. But that, I do just want to interject that, because I'm living it every day, and I'm happy to go to work, and I'm optimistic cautiously every day. So I just want to share that with our people out there, because I get it. People are nervous. If they are. So.
Thanks, Beth.
Yep.
Any other questions? Any other points from our health professionals that were we're missing, we're on track, as we said, staff, we look forward to seeing in on the 11th. We are starting sports up on the 19th.
Starting
no,
on 11.
11th as well, and then school, the first cohort will start on the 19th and the second cohort on the 25th.
Yep.
So that's the plan so far. I think we're on track. It sounds like we're doing everything we can. Again, 100% will be masks in school. Safety will be goal number one. Getting the kids back and the staff back in as safe as possible will be goal number one. So anything else from our health folks that we're not covering? Okay. Well, again, as always, the three of you are invaluable to us. We lean heavily on your expertise. As you said, we met earlier today to get an update. We are appreciative of that, and certainly your time this evening. And we'll look forward to speaking with you again shortly. So thank you all for your time tonight, and Happy New Year to everybody.
Thank you.
Thank
guys.
you.
Yeah.
Thank you.
Happy New Year.
Happy New Year. Okay.
Okay, so from there, we're going to move forward. We're going to do an update on our learning model. And I think Mr. Smith has his screen to share.
I'm going to share the screen. And let's see here. Everybody see that?
Getting there.
Okay. Let's see here. Yeah, I got it. There you go. Okay, wanted to take you through some of our updates in planning, and some of the items you're going to see in here are very similar to what our health and medical advisors have mentioned. One of the big things is obviously we're coming back in a hybrid instructional model, and that's going to allow us to have fewer people in the schools week to week. So the spacing in classrooms, and I think this was mentioned by someone in the previous discussion, can happen, and in many cases it may happen more than 6 feet apart, because we're seeing in the hybrid that we do have sections of 7 and in some cases even 6 individual students, then obviously with a teacher and possibly a paraprofessional in the room, but a total then you would look at 8. And so we can get that spacing larger than the 6 feet apart. We've talked in other meetings about the cleaning and disinfecting that is occurring throughout the day, and our custodians are very aware that as we increase people in our building, that this is going to increase where and how we do this, and we're going to continue to do it. It's things such as arrival finishes up and we're locking our buildings, custodians are not only locking our buildings, but they're also now disinfecting doorknobs and counters and different things that people touch on their way in. And they're also throughout the day monitoring things like restrooms and so forth, so that they can keep those clean and disinfected. And as we work through lunch, we'll work in coordination with our food service staff, as well as our custodians, to make sure that in between each lunch, we are disinfecting tables and so forth. And to Mr. Thompson's point, we're looking to do this in the safest way possible. That's something that has always been priority one. So all our classrooms, and Kelly LeBombard, our nurse leader, was talking about the PPE we have. Part of that is that all of our classrooms have hand sanitizer in them, and also have alcohol wipes for wiping surfaces. Both obviously are products that can kill germs, bacteria, and viruses. I think we've said this before, but it's worth saying again that as we finalize numbers, we've placed our students who have decided to come back in a hybrid model in either an A cohort or a B cohort. That happened alphabetically, although I know that in some cases over the last week or so, we've had to make some shifts where possible to help out families and make sure that we're keeping families in the same cohort. And then this week and next week, you're going to see more information coming out from your school or your child's school, indicating some of the changes to procedures, how arrival and dismissal may work, as well as any change to the daily schedule. We had, in our last meeting, put up some example schedules, and there were not dramatic changes as we move from a remote instructional model to a hybrid instructional model. And the hybrid allows each cohort to come in for a full week of in-person instruction, followed by obviously a week of remote instruction as the B cohort comes in and has their in-person learning. However, one of the things that we did learn and see happening in districts around us is that the live streaming can work. And so we're working over the next few weeks to make sure that we understand how to use this equipment and that we can live stream to our students who are in either the off week or have elected to remain completely remote. And they always have that, that option to move back into what we're calling cohort C, which is staying in a fully remote instructional model. Families also can change the other way. What we're asking is, as you seek to make a change, that you alert us by the 15th of each month. So we're coming back in January. So if you are interested in having your child move into the hybrid in-person instructional model, we would need to know that by February 15th. And then the change would happen on March 1st. And then that would continue in the next few months. We would need to know by March 15th for an April 1st start. One of the things I wanted to just show you that we'll share out in coming days, we'll post, and I think the schools will also take this to a more specific level. But just give you an idea, this is what our calendar usually looks like on the webpage, but we've adapted this calendar a little bit to start in January, and then over on the right-hand side, just designate what week it is for the cohorts coming in. So the start there you see would be A week, starting on the 19th, and then B week would be the following week. And we go through the entire year, and we'll post that if that's helpful for families so they can see that. We've also captured some of the things that we traditionally capture, which are, you know, half days, parent conferences, and so forth. And so we'll get this up on the webpage. But I think schools are also going to be sending out more specific information, you know, regarding A week and B week and things that parents should look for. The other thing we talked a little bit about with our health and medical advisory group, is that we need to make sure that all of us, if we're going to keep people safe and healthy, then all of us on a daily basis, every day, should really go through a daily symptom checklist. And Dr. Clark was highlighting some of this, and if you can see this on screen, this is a form that we're going to send out to all families, and we had done this earlier in the year with students who started with us in person, and it's just simply lists out the symptoms that we should be looking for. And when you have a chance each morning, after you've gotten out of bed and gotten moving a little bit, just to take a quick inventory of yourself and your children in terms of these symptoms. And Dr. Clark had mentioned the fever. It's 100 degrees or more that tends to be the threshold. We also talked about a cough. And Dr. Clark mentioned, you know, people who may have a chronic cough due to allergies. That is something that you may just want to discuss with your primary care physician to see, okay, what else should I be looking for, since I seem to have the cough pretty regularly. And actually, having allergies myself, that's something I have regularly. And so those other things are shortness of breath, chills, fatigue, muscle or body aches, not the ones that as you get old like me, you feel every day, but the ones that are new. Congestion or runny nose when in combination with some of these other symptoms. Sore throat, headache, also when in combination with other symptoms. And some of the ones that are a little bit more unique, but people have been talking about, new loss of taste or smell, sometimes nausea or vomiting, and diarrhea. As far as I understand it, the sort of the top ones are the most common. And as you get down to the bottom ones, these are some that people have also been experiencing, and so it's good to know. Also, as you go through this, you just want to look at, okay, who have my children been hanging around with, and do we know of anybody, as Amy was mentioning in our discussion earlier, who may have tested positive? That's where the contact tracing comes in, and the more we know, the better job we can do to make sure we're keeping people safe. The last one is, has your child been asked to self-isolate or quarantine by your own doctor or a public health official? Obviously, if that's the case, then you want to stay home.
Gordon, you may have said that, are we planning to send that actually the paper form home with the students?
Yes,
Or
I'm
will it be
planning on
available-
sending this out to all families.
Okay, and it'll be available on each school website and
Um, It can be available on each school website. We'll put it in under our health services area of our main
The district
webpage in the
website?
district website. Yep,
I'd just like to make it easy to find.
sure.
Because some folks should be very often.
Right. No, I agree.
Yeah, multiple places, multiple locations.
And the bottom line, and this is for staff and students, that if you are feeling sick, stay home. Address the symptoms, check in with your primary care physician. If you're seeing a number of those symptoms, it might be wise to go get a test at either a Stop the Spread site or some of the other sites that were mentioned. We can also put that link to the Stop the Spread sites in Massachusetts up. Any letter that I've sent out or email that I've sent out have included that link, but we can get that up on the webpage as well. In terms of ongoing planning, things that we're continuing to do, I know people have asked about transportation. Some of the things that we've said the last few meetings is that unfortunately our safety protocols has forced us to reduce ridership. So right now, as we start up transportation, we're looking first at students whom we are legally required to transport. And so that rider list has been assembled. We're starting, or we're actually getting close to completing the routing. And what we will do is be sending more information out to these families first, see what our ridership looks like, and we will add accordingly. But first and foremost, with anything that we're doing, make sure that we have the safety protocols firmly in place. The other planning element is that we know that there will be situations where staff may become or may come to a situation where they're being asked to quarantine. And so if that's the case, we're going to continue to work with our health department. Amy mentioned this. One of the keys that we found throughout the fall is, and I can't say this enough, our nurses, Kelly as the nurse leader, they've been exceptional. And they have been very quick to help with the contact tracing. I think our families appreciate that because they're being contacted by someone they know. And that helps us put together pretty quickly where we think the close contacts are and where the transmission may have occurred. And then obviously we're alerting individuals if they need to quarantine. As we're planning for this, we're trying to increase our staff. We do have a couple permanent sub postings out to see if we can add to our sub pool. But also administrators are looking at schedules and seeing where schedules can be flexed if need be. Because I think the biggest challenge that we've seen districts around us have is the fact that they run short of staff, not necessarily that there's been rampant transmission in any of the schools. I don't think that's the case. It's more when you have one positive and quarantining that seems to have started to impact buildings. And families should have a contingency plan because this can happen, in 24 hours. One day we could be functioning very normally, and the next day we may have to get into contact tracing. And if some families are impacted, they need to have a contingency plan where they may be quarantining and in a remote instructional environment for 10 days or so. Okay, that's actually, I think, my final slide. So I'm going to stop sharing and see if we can answer any questions.
Questions from the committee?
And I just, just keep getting the message out there. I mean, this is all stuff we've all heard before, and it's important that we just keep, for lack of better terms, hammering it home. Right?
Yeah, and I would say, our plan continues to move forward, as we mentioned and talked with our health experts. We do understand that numbers are rising within the community. We knew that was going to happen. Statistically, transmission is not prevalent in schools, and until that becomes the case, that it is prevalent, then we will continue to move forward with the plan. The only other thing that would hold us back would be if the governor was to say that schools could no longer be in. So just so families are aware, those are really the two things that we'll be looking at moving forward. And we've discussed at length with our health experts that that's what we should be looking for. Transmission in schools, if that becomes prevalent, or if the governor says don't go in. Other than that, folks, I would expect that we'll have more students in the building on the 19th moving forward.
And I think it was a wise decision to go hybrid, because that allows you to put all these safety protocols in place and allows for even further distancing than, say, the 6 feet in many cases.
Right. That and putting contingency plans together in case something does happen. I mean, it's a lot easier now being January than it would have been in August. If we decided on August 6th that we were going to go hybrid, and all of a sudden, September 1st or September 15th, we run into a
We've
problem.
had time to plan. We've seen
Yes.
what other districts have done successfully. We know what it takes to keep folks as safe as we can, and we'll implement those things.
And I think it's important to note that the surrounding districts, which are all remote now, it's not because there were transmissions in school. All right. There's varying reasons why these districts are remote, but none of them were caused by an influx of cases in the school buildings.
Or they're just given a cooling off period from holidays.
Right.
That's what my district's doing. Some of the kids are in, the staff is in, as we always are whenever the kids are remote. And we're just, being cautious.
But I think it's the right time with our plan to move ahead on the 19th and go forward.
I know Mr. Smith and I promised a video. We're going to try to get in one of the elementary schools probably this week, do a day in the life of a student, just so folks, families and staff even will know what a day will look like for students. We'll try to get that out end of this week, beginning of next week, so folks can get a few of their questions answered. As Ms. LeBombard had said, certainly if you have questions regarding your own student, please feel free to contact the nurses in your school district or Ms. LeBombard herself, and they would be happy to answer those questions, or also your primary care physician, certainly a good resource. Okay, so I think that pretty much wraps up the update. Any other points or questions on that?
Good job as usual.
Moving
Yeah.
forward with the plan. Yep. Okay.
Can I just affirm too, we had talked about it, but DESI's guidance still sits at 3 feet, correct? So when we're talking about 6 feet here and when we're bringing kids back, that we're doubling what DESI's guidance is, and in some cases, based on the numbers, Mr. Smith, you mentioned, we will be able to be even further or greater than the 6 feet recommendation. So we're coming back beyond what the minimum recommendations are, well beyond in some cases.
Correct. When we had measured out in many of the classrooms, whether it be elementary or secondary, we were looking usually at somewhere between 12 and 14 desks that could be spread out at 6 feet. And we're in the hybrid model, we're far below the 12 and 14 for most sections. And so in those smaller sections where we're averaging, say, 6 or 7 students, you can get well beyond 6 feet and spread it out.
That's great. And then in terms of if there is a situation where students are asked to quarantine, or if a child is feeling potentially symptomatic, or a parent is, erring on the side of caution, that doesn't preclude that child from then joining the remote cohort for that day. So there's not disruption in learning for the child. I just want to clarify that. So if I'm concerned that maybe my kid woke up with a cough and I'm not thinking it's allergies, I can still have my child join in so long as they're feeling okay, but I want to be cautious and not potentially bring something into the classrooms.
Absolutely. That's, we're almost changing how, we viewed work and school. We're not going to power through colds. If you have those type of symptoms, which also are the symptoms that we highlighted for COVID-19, then please call your child in sick to the main office, check in with your primary care. But to the point you were making, Mr. Trulio, that they can then connect remotely. That's going to be the great part of this transition, is that our students still can connect into the classroom.
Thank you.
Sure.
And I would just like to ask, families and students to just have patience as we move forward. We're asking a lot of our staff now to transition to another learning model. Certainly they're there to step up to the task, and they're working hard in preparation. But we have a lot to learn, and there'll be some trials and tribulations. There will be it will certainly look different. We foresee some staffing issues in terms of, there may be some minor changes, but, we're not quite sure of those yet. But, be patient with us. Understand that the staff is doing the very best that they can, and we are certainly appreciative of that. And as a community, collectively, we're gonna get through this and get these kids, the ones that are going to be coming back in the cohort A and B, some in-person learning. So we're on the right track, and we're going to continue to move forward with that.
Yeah, I think one other quick thing for our families is, I think just going back to as far as health and being well and all that kind of stuff, it is big just to understand that this isn't normal, and that you have to have a contingency plan for every single day. Because one day you can think those kids are going to go into school, you might go remote, or your child might be sick, like we were talking about, or someone else, and they're going to be back to whatever your contingency plan is. So it's really important. It's not, I think it's going to be good to get them back, but it's not going to be easy, because we're still going to just be in that place. But the kids will be happy to go in. That first week, they kind of come in that first day, and I remember the kids were kind of like, by the end, like by the second day, they were back to talking normal and goofing off, even though they knew what the rules were, and they were happy.
And then worth noting for cohort C, certainly their education as important as everyone else's. We will be live streaming from the classrooms. They will be receiving the same education that those students in cohort A and B will be getting when they're not in school. And certainly the staff has an emphasis on those families and students that have decided to remain remote. We don't want to forget about them. All students are important, and the staff certainly has them all in focus. So appreciative of that.
I think it's also okay to understand it's all right if your student comes back and they want to come back home. I mean, it's understandable. If they're afraid, have them give it a try. And then, if it's something that isn't for them, it's, we can get you back into the remote at any time, because they're going to be there with the rest of the kids, like Greg was saying.
Yeah, it's going to be a shock for some of them walking in and never seeing a classroom and what it's going to look like now. So, I agree with what Beth's saying. So, whatever works, whatever fits.
Okay.
Yeah.
Yeah, definitely.
And families can expect to get more information. I know you said this, Gordon, but specifically from their school. So regarding mask breaks, regarding lunch coverage, regarding arrival and dismissal procedures. So when should families anticipate having those conversations or getting that information from each individual school site?
I would say that you're probably going to start to get information toward the end of this week and the beginning of next week. Some schools have set certain things up. We have a principals and directors and assistant principals meeting on Thursday. We'll continue to coordinate and make sure that we're sending out information from all schools, but also from the district.
Okay. Good discussion, folks. I appreciate it all. And families and staff, thank you for being on board with this as we move forward. Okay, we're going to move on to our next agenda item. We have an early childhood targeted special education program improvement grant. Pam, I think this is your
Yeah.
expertise.
So as Mr. Thompson just said, we are the recipient of this new grant, and I'd like to thank Dr. Welch, our Director of Student Services, as she is the one who put in that application. It is in the amount of $2,524, and it is for the pre-K program to buy additional supplies that were unanticipated due to this whole pandemic. We need additional toys and those kind of things to keep everybody, all of those items being separate. So I would like to request that the school committee officially accept this grant.
Okay, I move to accept the early childhood targeted special education program improvement grant in the amount of $2,524.
Okay, motion's been made by Beth.
I'll second.
Second by Bill. Discussion. All those in favor, please say aye.
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 Those opposed, nay. That motion carries 5-0. Thank you.
Great, thank you.
And then we have a request for an 8th grade waiver for the East Long Meadow High School ski team. This is a topic that we did discuss last meeting, and Mr. Smith, you have some stats on that?
Sure. So as you said, Mr. Thompson, this was something that Mr. McGee had mentioned as he was presenting with Mr. Page at the last meeting. We had asked them to sort of separate this out and just discuss winter sports at the last meeting. So this is a request to put into the MIAA a waiver to allow 8th grade students, girls and boys, to possibly join the ELHS ski team. Right now, in discussing this, coaching staff, athletic director, high school principal, and middle school principal are in support of this waiver. Currently, they feel that the girls ski team has approximately 7 members in grades 9 through 12, and they feel that there might be another 2 8th graders who are interested in possibly joining that team to make a total of 9 possibly. The MIAA suggests applying for this waiver if you are looking at a ski team less than 8. So the girls ski team at 7 obviously qualifies for that. Hopefully there are 2 8th grade individuals who would be interested if the school committee is in support of this waiver. The boys ski team right now, they feel, have approximately 4 members in the grades 9 through 12. Excuse me. That's allergies, not COVID. The number of 8th graders who may be interested in participating on the boys ski team are, again, possibly 1 or 2 athletes from the 8th grade. And so that if we get both, would bring the ski team up to 6, still be a pretty small boys ski team. We have done this waiver in the past, and so we're asking to put in an additional waiver for this school year.
Okay. Someone want to make a motion, please?
Move to approve the 8th grade waiver for the ELHS ski team.
Motion's been made by Bill. Second by Antonella. Discussion.
Can I ask a question?
Yep, go ahead, sir.
Does the ski team at the high school, is it not able to move forward if the waiver isn't approved? Or is this just a recommendation from the MIA that you seek out? Like, is it?
Well, the boys team could be in jeopardy depending on if all 4 remain. But it looks like the girls team probably would have enough to move forward. But they're looking for increase in their numbers, obviously increase their talent as they approach the season.
And is there are we able to add members to the team like in 2 weeks? I mean, my concern here is that we're trying to open school, and we can go, if we can go forward with a high school team without having to potentially cross or intermingle buildings right now. Like, I don't want to not allow a sport to be able to go forward, but I also want to ensure that bringing forth academics across the district is the primary focus. So
Mhm.
is it possible to revisit in a couple of weeks, or is that not allowable based on the shortened season? I'm just curious in terms of.
Yeah, it's a 6-week season, Sarah, which starts on the 11th, so I wouldn't say we would want to wait. I think as Gordon alluded to, the boys team would not be able to proceed without the waiver. Potentially the girls would, but it would probably be a filling events kind of thing. I understand your point, but there's still small numbers, and we'll have a transportation provided. There'll be socially distanced on the transportation, required to wear masks.
Under the circumstances, will students be able to have their parents bring them back and forth? Is that something we allow?
I don't think we have allowed that to the ski mountain. I don't know that we've ever done that. We've always provided transportation for the skiers.
I'm thinking based on the distance, it would be better that we stay with probably the way we've been doing it. I understand what you're saying, Beth, but
If it's a difference between, a family feeling comfortable doing it and not, and being able to have the program, and maybe to what Sarah's point, the crossover, but it would have to be the physical parent, they can't be signing off for just anybody.
well, I think that's why you kind of gotta just keep it structured.
Well, they go a couple times a week too.
Yeah.
Yeah.
Well, there's practice and there's,
Yeah.
What's the pleasure of the board?
I mean, I'm personally open. I'm personally open.
Okay.
But I feel that that's a family choice for the sport.
right. All
I
this is,
understand what Sarah's saying though. But
oh, I get it. These are all family choices. I mean, we're not forcing anything. We're just opening the door to allow things to expand.
But by opening that door, are we potentially, for lack of a better phrase, like shooting ourselves in the foot? Like,
Well,
it's one thing to say that we're having students within one building who are already going to be potentially intermingling, but then to say that we're opening it up between two buildings.
Well, I mean, it's an outdoor sport, so I mean, I understand what your concerns are.
How many personal parks is this?
2 per team, it looks like maximum.
I mean, I don't think we're really shooting ourselves in the foot. We're just giving them the opportunity. I mean,
Yeah, I personally, I think there's enough room for social distancing on the bus, and being an outside sport, inevitably, we have mingling between buildings and families anyway, so I'd be comfortable with it. So why don't we, any other questions on this? Okay, why don't we make a motion?
So you have a motion and a second.
Oh, we do? Okay, yeah, thank you. Any other discussion on this? Okay, all those in favor of the waiver, please say aye.
Aye.
Those opposed, nay.
Nay.
Okay, that motion carries 4-1. Okay. Another very productive meeting. I am certainly appreciative of everyone's time this evening. Again, we look forward to having more students in-person learning on the 19th, sports to begin on the 11th, teachers back in the buildings on the 11th. And
it's nice, we were almost all in one room.
Yeah, we're getting there.
yeah.
Yeah.
Yep. Okay, with that, I would entertain a motion to adjourn, please.
So moved.
The motion made by Bill,
I'll second.
second by Beth. Discussion. All those in favor, please say aye.
Aye.
Aye. Those opposed, nay. That motion carries 5-0. Thank you, everybody. Have a good evening and
Thank you.
Happy New Year.
Take care. See you later.
Night.